Hello, everybody. My name is Priyanka, and today I'm going to talk about the impact of coronavirus on the healthcare system and economy in any country. In general, this is what I'm going to talk about today. So, first of all, as you know, the COVID-19 is an infectious disease that is caused by the coronavirus. As you can see in this diagram, this is a picture of the coronavirus, and it all started as an outbreak in Wuhan, China, here. The disease has spread to the UK, US, Italy, and various countries worldwide. And in March 2020, it was confirmed as a pandemic by the World Health Organization. Right, so the coronavirus can present in different forms. It is a family virus that can present in common colds from various intensity, so from common colds or MERS coronavirus, Middle East respiratory syndrome, or severe acute respiratory syndrome coronavirus. From the name itself, you should know that the coronavirus present mostly with respiratory problems, as you can see here. Fever, fatigue, dry cough, ache, runny nose, sore throat, shortness of breath, and diarrhea are symptoms of the coronavirus. And the patients that are likely to be at risk from this virus or disease is cancer patient, individual with cardiovascular disease, individual with diabetes, or individuals with chronic respiratory disease. The disease is airborne, which means it can be transmitted through the air. It spreads through the saliva, droplets from the nose, and you can get it from contaminated surface and human to human interaction. So the disease can also be transmitted through animals. So the basic guideline is for you to wash your hands with soap and water after contact with animals. Eat cooked meat, and wash your hands with soap and water. So I'm going to talk about what the coronavirus means to the healthcare industry. So generally, there has been an increased number of testing since the pandemic and an increased use of personal protective equipment worldwide. Now I'm going to talk about the National Healthcare Service and what the coronavirus meant to the economy in general. So generally in the UK, the NHS healthcare system is the National Healthcare Service is a universal system, and it's free for the public to use. We classified it as free, but we all know that we pay for this in an informal way through tax. The NHS costs approximately $11.4 billion per year, according to Research Briefing, and sometimes it can be classified as overcrowded because everyone uses it, and we've been having some problems. Sometimes processes are longer, and there's longer waiting hours, a lot of elimination-based diagnosis, and basically this bit here, a lot of elimination-based diagnosis when answers can be found straight away with new techniques and technology means this is when compared to private care. So I'm not a professional. This is what I found based on my research. And I'm not claiming I know everything, so I'm just presenting information for you to make your own judgment. So in the US, the healthcare system is not free. and it's not universal. Usually, people pay for their health through an insurance. Economy-wise, in the US, the salary for doctors and nurses are higher, and drugs are higher in prices. If you imagine that you're paying through insurance, the care is more likely to be personalized to the individual needs rather than a general approach that's suited for everyone, in contrast to a universal healthcare system. This generally means a faster and more efficient service. People have more choices on the treatment type and where the treatment can occur. And all in all, sometimes in the US, people who are not protected by insurance have to pay for their people generally pay for their health in the US through insurance, but those that are not protected by insurance uh, is not protected. So, in the case of coronavirus, the US government has given incentive for people, free incentive for people to be tested and treated in the US, I think, yeah. And basically, we are all paying for our healthcare, but the system we pay it through is different. In the US, they pay it through insurance, and in the UK, we pay for our NHS through taxes. So it's not free, you're paying it through taxes. This brings up which system is more suited for which country and which one should you choose. Well, the answer is there's different approach for different countries. Countries opt for either two extremes. So what I mean by that, the NHS uses the universal model, classified as a free healthcare, and in the US, there's a private healthcare model, which is people pay through insurance. As discussed before, there are different advantages and disadvantages for each model. And for my thinking and my idea is, why can't we be in the middle? Instead of us choosing, oh, we should go for insurance, or we should have a universal healthcare system, why can't people, the right question to ask is, why can't people choose on where the investment on health should go? So what I mean by that is, if this presentation, let me go forward. So what I mean by that is, if people want to opt for a free universal healthcare, they can. And if people want to go for insurance, they can, and they don't have to contribute towards the free universal healthcare. The right question to ask is, why can't we choose? We can choose those who want to go for free universal health can, and those that don't want to, they can pay through insurance. The right question to ask is, should we change our financial model to adapt for different people's needs, i.e. a personalized finance, so that people can make an informed decision on their investment to health? Because sometimes you will notice that the NHS is sometimes constrained. Having two models may help relieve pressure of the NHS and demand of the NHS, therefore giving private insurance a chance. This is the best scenario for a win-win situation, and if the government wants to go for that model, why don't they? A consultation should be made with experts to make this model work. For example, experts from finance, economics, and from the healthcare. I hope you enjoy this presentation, and as always, please leave me with your feedback and comments. Thank you.